Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Hello, and welcome to the Empower Hour with Greater Nashua Mental Health. My name is Dr. Cynthia Whitaker, and I have the privilege of being the President and CEO at Greater Nashua Mental Health. And I love that we get to host this show, the Empower Hour, to provide you, our viewers, with information that can help you to be more empowered yourself or to help others around you. Today, I'm so excited that we get to talk about a really important topic: services for individuals who are part of our armed forces or who have served in our veterans. So we have with us today Alicia Somers, who's the coordinator of our armed forces and veteran services at Greater Nashua Mental Health, and Justin Moeling, who is from the Manchester VA, and I'll let him introduce himself shortly. So welcome to the show, Alicia and Justin. And Justin, if you would you please start with who you are and what you do?
Sure. I'm a social worker at the Manchester VA. I work with our suicide prevention team, primarily in an outward-facing role, building coalitions, supporting community partners, and essentially leading up a public health approach to veteran suicide prevention. The way that tends to play itself out is building community coalitions around the state to mobilize the community in support of veterans. I've been doing this. This is a new-ish program at the Manchester VA. It started 2 years ago when I was hired. Prior to this, I was working in Boston at the VA, running one of the mental health clinics down that way. I'm a Coast Guard veteran myself and excited to be supporting fellow veterans in New Hampshire.
Well, we're glad you came to New Hampshire, and I'll let Alicia introduce herself and maybe even share how it is we got to know Justin.
Absolutely. So I'm Alicia Somers. I'm the coordinator of services for members of the armed forces and veterans at Greater Nashua. I actually took on the role about a year ago, so our program is a baby.
It is a baby.
And Justin was a contact that Sheila from Greater Nashua had, and he has been an integral part of our program development. I think we had an initial meeting shortly after I came on. There were a few of us, and he's just sort of been a huge help in identifying the resources in the area, helping us through the coalitions. I'm a co-facilitator of Stronger Together Veterans Coalition. We meet in Milford, but we're based in the Nashua area, and that came about through the public health approach that Justin was talking about. So he's sort of been our go-to person for like, where do we need to be? What tables do we need to be sitting at? How do I get in the door to sit at that table? So.
How do we grow and develop this program that we knew was needed from multiple standpoints for our community? Certainly there's a lot of programs for veterans, but being the mental health center, we have such a wide array of services that we want, members of the armed forces and service members, veterans, to have access to.
And we've been able to take this hub and spoke approach because there are so many resources out there that it's mind-boggling and it's overwhelming to try to navigate them. So by having our program, we're really able to help our clients navigate what's out there and what's going to be sort of the best fit for them and guide them down the path, whether it's a housing program or financial program or a coalition for social support.
So why don't we talk a little about the coalition, since you've both now mentioned them. So Justin, you've been part of setting them up in other areas, and we didn't have one here in our area from what I understand, and until kind of the two of you put your heads together and made this happen. So whoever wants to jump in, like what exactly is a coalition, and how's the new one looking here for our community?
You were on the scene before me, so.
We have about 8 active coalitions in New Hampshire. With the exception of the Lakes Region Veterans Coalition, they're all new since I got started in this role. The Lakes Region Veterans Coalition was already established. It was created through a different VA program, and they've actually, as a result of sort of being there first and having that experience, have been mentors for the other coalitions. Due to the need for veterans to be supported with suicide prevention efforts in the community, the VA is not able to do it alone. We need our community partners. So part of my role is to identify community partners that are interested in joining the fight, so to speak. And the coalitions essentially have been a way to collaborate with other folks, work really hard not to compete with other veterans groups. There's so many wonderful veterans groups in New Hampshire. The grassroots efforts are really phenomenal. We're really eager for any veterans group to join the work that we're doing. We're definitely not interested in competing for resources. And that kind
So
of
who tends to be part of the coalition? Right, it's not only providers or people providing services, right? You want to make sure there's others at the table.
Yeah, we definitely would. Right now, Stronger Together,
Which is the Nashua Milford region.
Nashua,
yeah?
Milford area.
Yeah.
It is primarily providers, and like I'm the co-facilitator now, but I cannot take credit. It was really started before I came onto the scene. I went to one of the first meetings, but all the background had started, and it's sort of based out of Arc, New Hampshire, and Milford.
Oh, excellent! Yeah.
So they were sort of the spearhead of it, and it's become its own thing. But it is right now heavily providers. We would love to get the word out that we're there, that we're open to the community. It's a really great place, trying to just bring a community together for the veterans and their family.
So people that have a passion for the mission, people that are veterans themselves, having
Absolutely.
the voice of lived experience, even though certainly some of the providers,
Absolutely.
including both of you, have had service experience or family members with service experience. But nice to have somebody maybe not in a provider role with that
Yeah.
experience also as part of the coalition, I would assume.
Absolutely. I think, the providers, we're all very passionate, but we also have sort of our approach from a clinical standpoint. So it's
Right.
nice to have someone that's like living it, that needs the social support and has that set of eyes.
Right, or a family member with a deployed spouse or a family member is certainly welcome also, I would assume. Yeah.
Absolutely.
I appreciate you mentioning family members, because I think that's an important part of the veteran and military community around us. And our coalitions are open to anybody that is passionate about supporting veterans. That's pretty much the main requirement for participating. And with a variety of different activities and things that we're engaged in, I think there's something that most everybody will find matches their needs or wants.
It's nice to have a fresh set of eyes and opinions on what we can be doing. I think last year for Stronger Together was very much like the setup, and this year we're very much like action oriented. So like, what are we taking out of our meetings and what are we doing with it, which is kind of an exciting place to be.
That is an exciting place to be. And cool to learn that they're throughout New Hampshire, throughout the country. So, I mean, if people are watching not from Nashua, they could certainly reach out to their local VA and find out about what coalitions are in their area, or reaching out to you here in Manchester. You would know what's happening throughout our state.
I'd be happy to connect with anybody who's interested. We've got part of my role, it's a little bit of a challenge, but it creates a unique situation, is that the VA wants me to support and create and help coalitions move forward but not lead them, which allows me to really be in a position to empowering folks in the community to take on this task of veteran suicide prevention. Also allows me to be able to support more than just a handful of coalitions. Part part of what I bring to the table is the subject matter of expertise of the VA, the technical expertise and access to all of the resources that the VA has. And this program is nationwide, so we've got over 1,000 coalitions around the country, all at various different stages of development. So we definitely pull on lessons learned from that. I have a whole support network that I can pull on that I bring to bear locally.
So let's talk about that important topic that you've just mentioned. So they're not set up just to talk and collaborate. They're set up with a goal and a mission, and that is to address a serious problem in our country of suicide amongst our armed forces members and veterans. And so, I mean, I'd love for you to talk about how important that is and why the VA sees this as important and why it's such a big part of our work, right? We're not just sitting back saying, come to us for therapy and services, but we're involved in the prevention piece as well. So let's talk about why that's important.
I think to start with, I had to write it down so I remember. As of 2020, veterans are over 57% greater rate of suicide versus non-veterans. So it's a smaller population, but a higher
risk
rate.
Yeah.
The VA doesn't reach all of the veterans in the community. So we've identified that it's important for us to use the coalitions as a force multiplier to support our partners in the community in order to be more effective at reducing suicide. It's been a great process. The state has gotten on board. New Hampshire DMAVs has provided some grant money to one of our partners, the Partnership for Public Health, 2 years in a row now. It's a small amount of money, but it helps to support the coalitions and help them move forward in their work.
It's kind of a sobering statistic, 56 times more, or 56% more. That's definitely a lot of risk.
And I think the great things about the coalitions, even though they are provider driven now, is that when you start talking about suicide, people immediately get all kinds of discomfort and thoughts in their head. And so, our ultimate goal is to provide a community, not just focus on the suicide prevention, but just focusing on community for veterans so that there is an increased avenue to prevent the suicide, but there's so much more to it than that.
Right.
And so while we're talking about suicide prevention, we're not just talking about suicide prevention. We're able to use these coalitions as a place to talk about everything else, social support and activities and just community. And it makes it a lot easier to bring people together because it doesn't feel as scary.
Well, and what I love about that, I mean, certainly, at Greater Nashua Mental Health, we provide services, but prevention is not just about having access to services. It's about creating a community. And we certainly know that being connected, feeling seen, feeling heard, feeling understood, as well as having symptoms addressed through treatment, decreases risk.
Absolutely.
So it's not just about services being available for folks. It's about creating that connection.
And I think, I am not a veteran myself. I'm constantly learning about military culture and veteran culture, but sort of one of the major themes is community. And, I think you can speak to this more is when I've taken my military culture classes, they talk about the community and then it changes when you come home and there's not maybe that same sense of community. And so, being able to have these avenues where we can give them something that is such an important part of the culture when they're not home, they should have it at home too.
One of the things that veterans often say that they miss and are looking for is that camaraderie that you're talking about.
Yeah.
After World War II, we had the veteran service organizations came about.
Right.
And most of them are even chartered by Congress to do the job that they do because of the importance of veterans being able to support veterans. That doesn't mean that folks that aren't veterans can't support veterans. But veterans do a really good job of reaching out, connecting, and supporting each other. I think the Army calls it a buddy check, that has expanded into a much sort of larger nationwide push to really encourage veterans to check in with each other. Say, how you doing? One of the strategic focus areas that we try to move the coalition work toward is increasing social connectedness, reducing social isolation, creating opportunities for veterans to come together and connect with each other becomes very important.
One of the things I'm reminded of, as we're using a lot of terminology, like even the word veteran, I think has had some misconception over the years, and the VA has even changed who's eligible and not eligible. So when we use that term at Greater Nashua, what do we mean? What's eligibility at the VA look like? So sorry for two questions in one, but you can each take one.
So, I think, and that's where we really get into the importance of asking the question.
Yes.
Because language matters. So, we should never be asking someone, are you a veteran? For Greater Nashua, we ask, have you or a loved one ever served in the armed forces, reserves, or National Guard? And that really encompasses it all, because for us, for my program, if you have served in some capacity, I don't care, discharge status, that sounds cold. It doesn't, eligibility isn't impacted by discharge status, branch, time served,
reserve
combat,
or not, right?
Yeah,
right.
So anybody that has identified they serve is eligible for our program. A piece of what we do is we really encourage connection to the VA, but that is just one avenue of what we do. And so for us, if you've identified that you have served, you are a veteran in our eyes.
Love that, love that.
The VA definitely has a list of eligibility requirements, and those do change periodically. We recently expanded eligibility with the PACT Act. Recently, the president was in town announcing the 1 millionth veteran signed up underneath the toxic exposures program that has hugely expanded eligibility for veterans. In fact, there are some veterans who may have been told they weren't eligible in the past who may be eligible now.
So really important that if somebody thinks, I'm not eligible for these services, that they ask again.
And on my team, we do that. We have people that have come in and they say, don't even bother, I'm not going to go to I'm not eligible. And every month we're like, I'm just going to ask you every month. And then we've had several people that have spent years thinking I'm not eligible, and they're willing to go to the VA and at least check with us.
Yeah.
And that's huge.
And then find out some have been.
Some have been, yeah.
Yeah. So great point.
The veteran service organizations, the VFW, DAV, American Legion, they have some great veteran service officers, as does the state, whose job it is to be an advocate for veterans in order to manage that sort of nexus between, am I eligible, am I not eligible, what am I eligible for? And as far as the suicide prevention part is concerned, we know that when folks are enrolled in VA, not necessarily even attending VA regularly, that's a protective factor for suicide prevention. If folks are actively engaged with VA, it's even more of a protective factor. Engaged in treatment is what the aim is. What I like about the coalition work is that it allows me to work with our community partners who are able to take care of veterans regardless of what their discharge status is, or whether they're National Guard or whether they're reserves. And it allows us to kind of team up and provide a wraparound support as opposed to only doing the part that we can do.
Right. And I think it allows the community partners, and at least some of the stories that I know I've heard from Alicia and Sheila, who you mentioned, or we get to learn from your expertise. So maybe somebody's not eligible for your services, but we've learned from you how you might have treated somebody similarly, and then we can help in a different way than had we not had that connection, to learn what best practices, those types of things. So we appreciate that part of the coalition too.
And earlier I mentioned the statewide supports for veterans are really quite broad. We also have the Military and Veterans Committee of the New Hampshire Suicide Prevention Council,
Right?
which allows, it's sort of informally set up as a central hub where all these coalitions can come together with other providers in the community. Public are welcome if they're interested in supporting veterans. And again, it allows that hub and spoke model to exist and to function. So we've got a lot of opportunity for supporting veterans wherever they are. And that's important. No wrong door approach is very important.
Well, I love that, no wrong door approach, right? Wherever somebody goes, we want to get them what help they need. I think there's been a lot of attention recently, especially here in New Hampshire, about 988, the mobile crisis system that our state set up statewide here, and how great that is. And yet some veterans might be hesitant to utilize that, but there's a whole other system that's connected. So the Veterans Crisis Line, and so that's another support that I don't know that we talk enough about. So can you share what that is and how it's connected now to the new systems that we have?
Absolutely. If you dial 988, that's nationwide
Right.
phone number for somebody who's in crisis. When you dial 988, veterans have the option of pressing 1, which then forwards that call to the Veterans Crisis Line. In the past, we just had one call center, and we found that we needed more resources in order to best support veterans at that point. Over time, the VA has tripled the size of the call centers to being, well, it's plural now, so there's 3 of them around the country. And we're really well set up to support veterans when they call if they're in crisis, and to support anybody who might be concerned about a veteran that is in crisis. People can call that number to get some coaching about, how do I talk to my loved one? How do I talk to somebody that I'm concerned about? The Veterans Crisis Line is also sort of the primary doorway into the VA suicide prevention system. If you call 988, it's not like 911 where the emergency crews are dispatched immediately.
Automatically, right.
There's a triage process. The idea is to support folks and match them to the best supports that we can. If needed, they can activate the emergency medical services. At the end of the phone call, excuse me, at the end of the phone call, the caller will be asked if they would like to be connected with their local VA suicide prevention team. Our suicide prevention coordinators in the medical center have 24 business hours to respond to referrals that we get from the Veterans Crisis Line. That is, every single one of those is tracked, and that's one of many performance metrics that is kept an eye on by the VA as a whole nationwide. Point being, the goal is to not have people fall through the cracks.
Yeah.
With that in mind, I do want to make the distinction that the Veteran Suicide Prevention Coalitions are not emergency services,
Right.
including myself. If somebody reaches out to me, I'm happy to talk to them, but the first thing I'm going to do is ask them if they've called 988
Right.
if it's a crisis. And I think that's important to keep in mind. But we also work to really promote suicide prevention training among the participants in the coalitions so that they can be supports for somebody who will be in crisis.
What are some of the myths around, like, how somebody can support somebody, right? That stick out to you that you've heard, or?
I think like the number one thing is people are like scared to ask if someone's experiencing suicidal thoughts because they think that that's suddenly going to put it in their head. Like, they're experiencing it now because I asked about it, and that is 100% not the case. Like, we need to ask so that we can get the support for them.
Yeah.
I think that's probably
That's the big one.
number one. Yeah, I think it's probably the biggest barrier to folks, checking in on somebody who might be, not themselves that day. And, I think one of the things that's helpful for people to keep in mind is that if you're checking in on someone you care about, that's a really wonderful thing. And it's coming from a place of caring. It's really hard to go wrong when you're doing that, if you're coming from that place. And if for some reason someone gets defensive, it's easy to just say, I care about you and you just didn't seem like yourself, and then you can move on from there. Or be in a place to be able to support that person in getting the help that they need.
Yeah.
And I think also, like, people just get anxious that, okay, like, I'm going to ask this, oh my gosh, like, what do I do if they, and I mean, even us as mental health professionals, like, we all have that moment of, like, what do I do if, and that's why 988 is such a great resource.
Yeah.
Like, knowing where your community mental health centers are such great resources, because you ask the question and now you know the resources. So if your loved one says yes, great, like let's
call together.
Let's call together. Or, if they're saying yes, but I'm safe right now, like, guess what? Greater Nashua, we have open access hours. Bring them down, bring them in.
Right.
Right.
Yeah, because I do think maybe not so much a myth, but a lot of the hesitancy is around where do I get the help, or is help available? And I mean, I think that's really what your work with the coalition shows is there's a lot of help available, but sometimes people just don't know how to navigate it.
Absolutely.
And I think coming back around to the No Wrong Door, we do have the 988 that is the local call center. And we have the rapid response program. And if folks prefer to go that route, that's perfectly fine. If folks want to go to the VA, we have urgent care during business hours. After hours, we don't have a full service emergency room. It's important that people do go to their community emergency room or the closest VA ER, I think, is White River Junction, which would be pretty far from around here for an emergency.
Yeah.
Fairly recently, the VA, our government passed the Compact Act, and under the Compact Act, emergency care for somebody who's in a suicidal crisis gets paid for by VA for the transportation to the emergency room, the care in the emergency room, the initial stabilization, and I believe it is 60 days of follow-up care after that the VA will pay for. You do not have to be enrolled in VA. You just have to identify yourself as a veteran, and the hospital and the VA will work on sorting out, is this person a veteran and how do we get this paid for?
Right, so people shouldn't be afraid to ask the question or seek help for monetary reasons, because there may even be support for that, depending upon what somebody is dealing with and their
if
status.
It's a real crisis, 911's appropriate.
Right.
Let the ambulance company and the ER know that you're a veteran. Any veteran that goes to the ER for any reason, the VA wants you to let the VA know. The hospital should know this. There's a hotline that they have. And that just allows the VA to kick its system in gear for paying for your care.
Yeah.
And that way you're less likely to get an expensive ambulance bill.
I think the biggest thing we can do is just remove as many barriers for our veterans as we can, because it's just so hard to reach out.
I love that, right? Like, and one way to remove those barriers is by working together collaboratively and acknowledging none of us can do it alone. Like, I love, right? Like, this is not the VA's got that, we don't have to pay attention to it issue. No, this is still an issue we all need to work with together. It takes all of us to support, our neighbors that are serving or have served.
Takes a community.
Takes a community for sure. What else haven't we chatted about that you were hoping we would bring up today?
I think, as we're talking about this, one thing is the Governor's Challenge portal kind of open to everyone. There's a wealth of online trainings that are like 15 minutes that I'm going to be honest, when I took this position, I think I dived down a rabbit hole and it took me a very long time to get out because there's just so much out there.
The Governor's Challenge portal would take you to Psych Armor, which is...
That's what it's called, Psych Armor.
Psych Armor is contracted with VA to develop trainings. It's one of a few different avenues where you can pursue trainings, and they have some really great offerings, things like 15 things that a military child would like you to know about what their experience is like. Or
That's like a common one because there's like 15 things veterans want you to know, like 15 things veteran spouses want you to know. Like, yeah, so it's like a whole series.
And understanding what a veteran or veteran's family experience is like, again, that becomes suicide prevention. We want to get to folks before it becomes a crisis, before we're calling 988.
Right.
We'll do it if we have to, but really want to focus on the opposite of all of that, which is connection and hope and empowerment. And
So people could get that education.
It's free.
It's free education, and you might just have a different interaction because you've had it where a person feels seen or understood, like, oh, you know, I heard that this is really hard, you know, prepping for deployment. Or, you know, it's not the first week of deployment that's hard for a family. It's after a little bit because that's when it kicks into the child and the family that that parent's not coming back for a bit, right? Just knowing that, I think, can help prevent because the person doesn't feel so alone.
And one of the trainings that's on there that's free, I forget how long it is, but they have a recorded VA Saves training on there, which is suicide prevention training kind of for the community.
We call it gatekeeper training. There's a few different trainings out there, and that's essentially sort of that first line interaction with somebody who might be going through a tough time or might be struggling with suicidal thoughts. And the VA SAVE training is specifically geared toward veterans, although the core aspects of gatekeeper training are the same regardless of the training. It's getting comfortable with asking somebody, are you thinking of killing yourself?
Right.
Knowing the signs that somebody might be in crisis, and then being prepared with some resources in order to follow up and support that person and get them connected with help. It's a free training that I would love to help folks connect with. The VA offers it for free, our suicide prevention coordinators and myself. It's about an hour or so. We'll come out into the community and provide that training for anybody that is interested. It's helpful to be able to have that conversation about how to ask that question because it just helps reduce that discomfort that people tend to have at that moment.
Right. I mean, I hear so many takeaways from our conversation today. I mean, there's so many of them. Greater Nashua Mental Health has these new services, and thank you so much for all the work you've done in connecting to our community and connecting us to people like Justin so that we can do this well. But 2, right, we've got No Wrong Door, right? 988, Veterans Crisis Line. There are ways to get people help in that crisis when they need it. And there's free education available for other kind of ways of learning how to support this community. That are free, that people can access either online or perhaps by calling the local VA find out what's available if there's a group of people that would benefit from hearing a training. And most of all, to ask the questions, right? To ask the questions and to be willing to share the answers to those questions, right? Like if you've served, let people know you've served. Even if you think it doesn't match this person's definition, it's okay. Because there might be more to it than you know. What else? What are the other takeaways? What did I miss?
I would encourage folks, if they want to learn more or participate further, a couple different avenues.
Perfect.
You can track down Alicia at Greater Nashua. You can also call the VA's main number, 603-624-4366, and ask for myself or ask for anybody in the suicide prevention team, and be patient. Might take a minute or two to find us. We telework pretty often, but I would love to follow up with folks and explore their thoughts about how we can support veterans in the community more.
And if anyone's interested in joining the coalition, it's the last Monday of the month from 6 to 7. Usually we meet in Milford or online, and for our next month, we're sort of location to be determined. But if you reach out to me, I'll make sure you get the Zoom link and let you know where we're going to be meeting, and we'd love to have more people at the table.
Yeah, that's great. And I think important if maybe there's other serving veterans in some other capacity, that they make sure we know, so that they can be at the table and we can, serve our community stronger together.
Stronger together.
Love that logo. Well, thank you both for being here so much. It's been a great conversation that I think is helpful for people to know more about. So thank you both.
Thank you for having me. I appreciate you giving attention to this important topic.
Yeah, my pleasure. And thank you for joining us for today's episode of the Empower Hour with Greater Nashua Mental Health. May you have an empowered day.